It's my pleasure to be invited in this Congress, and I would like to thank Dr. Luddington for letting me presenting this important topic in the life of premature infant. So today we're going to talk about toxic stress and how many of you are familiar with the term toxic stress as a concept in the neonatal care. And so, okay, next. So let's start to define the term toxic stress, and it is have been introduced about 10 years ago or 12 years ago in the literature, where it is known as strong, frequent, prolonged activation of the body stress response system in the absence of buffering support, where buffering support mainly to the preterm infant is the adult support, which is maternal presence. And so the exposure to stress in the premature infant has many sources, and of these, the first and most important is maternal separation, as well as the NICU environment, with the sounds, light, noxious stimulus, and also the repeated exposure to the painful and stressful procedure, including routine nursing care of feeding, diaper change, and health assessment. And so the problem is that toxic stress leads to physiologic compromise, and so the stress response starts here, the body's response starts to regulate, and then this impacts the neurodevelopment and the disease progression later in life. And so how we do in our practice? Up to date, it is not routinely assessing or evaluating stress in the nursing practice. Only if the baby cries, we say the baby in stress now. And so what are the obstacles that prevent us from measuring stress? First, lack of awareness of stress outcome by health personnel, and also lack of resources to support maternal presence. The mother has to be in the room with the baby, but she has to take care of other children at home. And also she needs the financial support, she needs the governmental support to be involved in the neonatal care. And also it is related to the lack of awareness in terms of mother, that they really need to have a big responsibility to be in the hospital until the baby discharged. And so what we can do is we have to provide a neuroprotective care and to promote the non-separation as well as minimal stressful events. And we have the infant and family-centered developmental care standards, where you can see here that we have to support the environment, the sensory environment, the parental involvement, and the family resources as well, and access to the NICU. And we have Dr. Luddington and her research team conducted a quasi-experimental randomized control trial to measure the stress and toxic stress related to the nursing care, especially diaper change, and how we can do to reduce the diaper stress. And so here is the procedure for the study, and the purpose is to determine diaper change effect on infant stress as measured by behavioral stress response as well as physiologic response of heart rate, respiratory rate, heart rate variability, oxygen saturation, as well as the skin conductance response, a measure of stress. And so the intervention here is that we have two types of diapers. One is the traditional one that has the undetachable tab, and then the novel one, we call it the novel diaper, which is the flex fastener that can be detached and inserted in the baby like in any position. And so we performed the diaper change in 4 positions, in the supine, prone, and prone to skin, and also the prone to supine. And so here is the study procedure. And so the study starts at 9 when we set our equipment, and until like 6 p.m. the last episode. And so for each subject, we are doing 3 routine nursing care episodes, 1 at noon, 3 p.m., and at 6 p.m., yielding for 4 consecutive days, yielding about 12 rounds of routine nursing care for each subject. And so here is a picture of the measure of stress that have used. The first is the see-through measure of sleep, wakefulness, and respiration, activity, motion. And so it is like a radar that sends signal of activities. The second one is the Brazelton behavioral state, and we can assess the infant behavior during the routine nursing care. The next one is the physiologic response. So we have the skin conductance, which is the mid-storm skin conductance algimeter monitor. And so it is a useful tool, non-invasive and easy to use. An artifact only occur if the electrodes been detached from the infant foot. And so in this picture, you see it's like a pulse oximeter probe, and there are 3 electrodes that will be applied to the infant foot, and it will send signal, those signal like peak per second, and it reflects the emotional sweating. And so the level of stress will be measured from the, we can say like from 0 to 8, which is the maximum level of the stress. And this is a reliable and valid tool that we can really use and access in each neonatal setting. Okay, and this picture included all, on the right, included all of the equipment that we use, like the skin conductance, so we can monitor the skin conductance, oxygen saturation, and the reflect of the see-through, as well as our system for incorporating the Brazelton scale during the assessment. And lastly is the Newnham stress, infant stress stressor scale, where we track each stressful procedure that premature infant endure within 24 hours. Not only during the routine nursing care episode that we measure, but also during the day to see how much stressful premature infant endure while hospitalized. Okay, so what does the results show up to date? So we have seen that diaper change increases stress by increased heart rate, infant motion, and decreased oxygen saturation and skin conductance response, and less stress with kangaroo mother care diaper change than the incubator. So we have the opportunity that some mothers say, yeah, we want to do kangaroo care, and we apply the diaper change on mother chest, and we have seen the effect of the kangaroo mother care in lower level of stress. And so the daily Newnham stress scores suggest moderate to high stress, and nurses perceived less infant stress with flexible diaper tabs and better diaper changes, which is like less disruption, more comfort, and easier in various positions, and a better fit. Also, the mothers report that kangaroo mother care diaper change is less stressful for infant, and they loved it, and they have, we have to ask them for their evaluation. And infant endure multiple stressful procedures related to routine nursing care, and the maternal presence or absence during nursing care has not been analyzed yet. And so this picture explains a physiologic and skin conductance response during the multiple attempts of IV insertion. And this is like about an hour and a half where nurses were trying to insert the IV cannula multiple times. And so the baby had like above the normal heart rate level, and this is like was continuously for an hour until they stabilize the IV cannula, where they have about more than 3 attempts, 4 nurses around the baby trying to get the access. And also there was incidence of the apnea and also desaturation. And the lower scale is the skin conductance response, where you see it's high. Okay, so as she mentioned that I am a PhD student, so it's an opportunity for a new research. And so the term toxic stress really need to be addressed in the literature. And Chunk et al. And Bergman have provided like a model that addresses the toxic stress. We want to utilize those models. And so on the left, you see the Bergman's model of the maternal separation, where in terms of toxic stress, the baby is vulnerable to with the environment and the routine nursing care. The baby is vulnerable to stress. However, if the mother present, that leads to resilience, and if not, that leads to more vulnerability. And so this is my research model, where I will be using Dr. Ludington data to have the analysis of the stress when the mother present versus when the mother absent, that we can say this is toxic stress or this is a tolerable stress. And thank you so much for listening.